we've been there, we probably have maybe almost maybe 250,000 records actually. So we have a lot of information. We work with Chief Boyd here and his officers, and we work with everybody. When people call in, it's helpful that if you know the person's date of birth and their social security number, and that you're related to the person. We just don't give out information to anybody. Sometimes we have situations that come up where we have a mad ex-wife or somebody who's trying to get dirt on somebody. So we don't give out information to everybody. It's helpful that you're the family member and that you're trying to find your missing person. So a lot of times we will know if a person has been picked up by the police and brought to our center, but we might not know where they're at right now. They might not be in the building. We actually have 150 beds in the building, and so we have a lot of people, especially like today, Friday, we're going to have a lot of people coming in on the weekends, Thursday, Friday, Saturday. And then it tapers off on Sunday when there's no alcohol sales. So are there any questions? We have, like I said, 2 shelter programs. We have people that are actually lined up at 5 o'clock. Our shelter opens at 5 right now in the wintertime. And they come in, they get a mat, they lay down, and they have breakfast in the morning. And then a lot of them, they just leave. But we have a record of everybody that comes into the building. They have to blow on a BAC machine. They have to be, people can come in and be intoxicated. So we have what's called a wet center, wet shelter where people can come in. And the other thing that we're getting the information out there too is that if people walk in intoxicated, then they're not going to be held for 72 hours against their will. If they're brought in by the police, then that takes a commitment. And if they've been there 3 times in 30 days, then they will be held for 72 hours. But if it's their first time, they will only be held for 12 hours. So we want to get that information out that you might see probably around 4 or 5 o'clock this afternoon, you'll see a lot of intoxicated guys walking to get the NCI to beat the police, try to beat the vans. And if they come in on their own, then they can leave the next day. So that's not a punishment for them. So thank you very much. I just want to get that information out there.
Thank you very much. Do we have someone from City of Gallup that would like to say a few words? No? Okay. Okie dokie. Sounds good.
Good morning, everybody. I'm Chief Boyd, Chief of the Gallup Police Department. I just want to expand on what Dr. Foley said. Our component in regard to trying to deal with the unsheltered of our community, we have 8 PSOs who are charged with driving the vans and looking for the people who need assistance, whether it's medical, whether they're intoxicated, whether they're passed out in the streets. It's their responsibility to find these people and get them to the shelters, whether it's medical or whether it's taking them to NCI. We have 8 of those positions within our department. Dr. Foley just gave you the numbers of clients that he takes in. As you can see, it's a tremendous amount of people that we have to deal with on a daily basis. Our PSOs are very busy, as we all know by now, that being intoxicated is not against the law. We don't charge these people with a crime. It's our intent to get them the help that they need, turn them over to the services that the city provides through Dr. Foley's NCI program, and we have a lot of success stories in that regard. We train our PSOs to understand how to deal with the laws that are in place that require them to treat these people in a manner where it's not in a criminal, they're not treated as criminals, but they're directed to be a part of the system to save their lives, to put them on a path that is more conducive to them improving their lifestyle, or getting out of a dangerous situation. That's the basis of what we do in regard to our PSO program. Um, we also have a component within our program where, as we all know, exposure is a big issue, not just in the city of Gallup, but the surrounding border towns. We have our PSOs also go out when the temperatures drop during the winter seasons. When it gets really, really cold outside, obviously, it doesn't take very long for someone to succumb to the elements. What they do, what they're entailed to do, is to go out. They're very familiar with the city because of the nature of their job. They know where people hang out, where they build their homeless shelters, where they're more apt to pass out. We've had this program for about 10 years, and I don't know the exact number of the lives they've saved through this endeavor, but they're basically out. It depends on the time of the year, the temperatures, but we put them out very, very late. They check and they walk the alleys, the arroyos, the ditches, some of the homeless shelters, some of the abandoned buildings, and they found more than a few people. They find more than a few people every year on the verge of succumbing to the elements. So it's a tough job for them. When you deal with an intoxicated person who doesn't want help, they don't want treatment, they surely don't want to go to NCI, they can get very resistant and violent. So, irregardless, I just want you guys to know that and give you guys some perspective on what they do, and they get a bad rap. I mean, they're not there to pick on anybody. They're there to save lives, and they're very successful at it. I just wanted to touch on that in regard to and piggyback off what Dr. Foley was talking about and give you an idea what our component in this whole process is. Other than that, do you guys have any questions about anything related, not just to NCI, but anything else related to the law enforcement side of the house? Oh, I'm sorry, go ahead. Challenges. I think we all have a common denominator when it comes to the challenge in regard to resources, funding, and manpower. That's my challenge as a law enforcement executive. I'm sure NPD has the same problem. I wish I could assign one detective to every missing person or homicide case. I wish I could do that. I just don't have the resources to do that. I wish my detective division was larger. I wish my narcotics division was larger. I wish I could increase our PSO division. It's just an overwhelming amount of calls for service that we answer. We answer everything from misdemeanors to homicides, and it's very overwhelming. Of course, it always relates back to funding and finance. That's my challenge. We have enough laws on the books. It's just a matter of trying to get these cases, give these cases the attention that they deserve. That's number one. That's just one component of the law enforcement, the judicial system. But I've said it before, and I'll say it again. Our courts are overwhelmed. We need more magistrates. Our district attorney's office is overwhelmed. We need more prosecutors, and yes, we need more public defenders. We all work in conjunction with one another, and if one component is overwhelmed or understaffed, that creates a backlog in trying to get these cases adjudicated or put through the system. And that's from the beginning to the end. That starts from the officers on the streets. Takes them if we're overwhelmed, it's going to take them more time to get to your case, to take it just an initial report, whether it's a missing person or a felony level crime. Then it gets transferred to the investigators. And if I don't have enough investigators, again, they have to prioritize their cases as well. So those are the challenges. I know it's a big challenge. There's no easy solution. Everybody in the justice system, we talk about this weekly and monthly, and we're always asking for support, whether it's you as citizens of our community talking to your elected officials, especially in Santa Fe, letting them know we need help. So help us help you in that manner. I'm sure you can get creative and come up with some more solutions. Doctor? So every report or every report that we get, and we're told that they're missing, by law we have to enter them and investigate them as a missing person. So there is no time limit. I'm sure some of you guys have heard that you have to wait for 24 hours or 2 days. I can't speak for other jurisdictions, but when we get a missing report, missing person complaint, or somebody wants to report anybody missing, we don't have no time limit. We'll take the report and we'll call out a detective. We have on-call detectives, and they'll come out at any time of the day to take a missing person, follow up, investigative report once the patrol officer takes the initial report. Does that answer your question, Doctor?
One more question.
I can't put a number on a percentage, but alcohol's not, again, the alcohol, we have a high percentage of calls for PSOs. Our dispatchers never stop dispatching for that. But in regard to crime and drugs tied into criminal activity, it's a fairly high number. I'm talking about everything from DWI to the root cause of some of our major crimes like burglary, assaults and batteries. It's tied into a lot of drugs, obviously, methamphetamine, things of that nature. Yes, I can actually. We brought our stats, and I'll call up my investigations captain really quick.
So we do have current stats of also how many we have taken in a year. We've taken about 97 to this year for 2009 or 2019, but that does include from runaway to missing all races, and we're not specific as far as what race is missing. But I did do a count as far as Native American and female Native American and Native American. So right now, currently, our grand total is 13 right now that we have outstanding. We have four. We actually had 4 open cases for Native American female, but as of yesterday, one of them was located. So that's going to be 3. We have 9 outstanding open active cases for Native American male, and that still is 9. So currently 12.
Any more questions?
Thank you very much. Okay, City of Gallup? Not right now? Okay. Well, we're going to go ahead and move on. We started this journey back in June. Actually, it started before that, but we started talking about it in Shiprock. We had our very first forum in Shiprock. And, the thing I wanted to tell you about, it's really important for you guys to know where we came from, the context. We're not going to start brand new every single time. We want to build on everything that we've already worked on. Our team has always been very multidisciplinary. We have people from the community, we have nonprofits, we have government, we have law enforcement, we have court folks, we have university folks, we have healthcare folks, behavioral health, social services. It's been a different mix of people every single time, and I think really together we are well equipped to make some impact on this issue. So this is the Navajo Wellness Model, and the reason I put it up there is because it's kind of like this. This is our public health approach. So this is how we, figure out our way through problems in public health. So we define the problem, surveillance with data, and then we identify risk factors, who, what, where, what prevents the problem, and that's kind of what we're in the stage of right now. We've kind of talked about surveillance, but then we might circle back and add some more information to the data. We might go back and we might have somebody new that identifies additional risk factors, and then we come back over here and in the implementation phase, and then what works. We go back and we do our projects, we do our efforts, and then we go back and evaluate them. But we're not done. This circle never ends. Just kind of we're just moving forward in time and space. And so it's kind of like a slinky, we're in. So what I want to do right now is to actually, take you back to where we started and bring you forward again, so that you kind of know some of the stuff that's already talked about, and so that we can build on it. So the very first forum we had was in Shiprock. It was at Senator John Pinto Auditorium at Diné College South in Shiprock. And that was June 27 and 28, 2019. And there we talked about the shared vision. On our agenda, we had traditional blessing and song by Rita Gilmore. Navajo Nation leadership welcomed the group. Anita Lucchesi, executive director of Sovereign Bodies Institute, spoke. Mesky also talked about the Navajo Nation Missing Persons Update Group. We had Strengthening Families program from the Division of Social Services. We had the IMS from Public Safety come and talk to us. We had Ramona Antonez from the Epidemiology Center come and talk about some of their data. We had Lauren Benally from the Human Rights Commission, Navajo Nation Human Rights Commission, talk to us about some of their work that they're doing. And then we have the Data Framework Services Support Coalition to Stop Violence Against Native American Women, the Southwest Indigenous Women's Coalition, and Restoring Ancestral Winds. And they all did presentations. They actually did a panel. And then we had the Major Crimes Act discussion with Robert A. Williams, Milton Bluehouse Jr., and Robert Yazzie that did a panel on that. And then we had awareness and advocacy from New Mexico's Secretary Lynn Trujillo, Arizona Representative Winona Benally, and from Moroni Benally from Restoring Ancestral Winds in Utah. That was another discussion that we had. So that was the agenda that we had then. And we talked about what people heard and observed in the last day and a half of the forum. And some of them talked about the toolkit. We had, that the conversation starts at home. We talked about LGBTQI2. We talked about, moving from missing and murdered Indigenous women to missing and murdered Diné relatives, and how that happened, and I guess bringing that into our conversation. Are we going to operate in sectors or silos? Is this information going to create a program? Data barriers, restrictions, approvals? No specific department for family support services. We talked about data sovereignty. We talked about the Sovereign Bodies Institute, and information from the border towns like Gallup and Farmington. We talked about extending the discussion to metro areas. We talked about confidentiality with data. Who's the point of contact? How would the remains of relatives be handled? Barriers, getting approval from Navajo Nation, peacemaking, Diné language framed in context of healing, stories, not just data, how other types of trauma intersect with MMDR, racial justice, system changes, gender, not just male and female issue, responsibility of poor choices. How much more will it take for the community to open their eyes? We need the entire community involved. Be aware of your surroundings, social media, who we talk to. There's no specific department anywhere, and not just on the Navajo Nation. Law enforcement and prosecution, way beyond capacity. First responders also susceptible to vicarious trauma. Understanding trauma and be trauma informed, understanding dynamics, asking questions and learning other data collection methods. Standalone advocates benefits is that there are more victim and human-centric. Waterfall slides look at different data and frame data. Include all unattended deaths. Form a team to look at trends and misclassifications. Educate what's beyond behavioral risk. Impact of pornography, interpersonal violence, influence how we view people in terms of dehumanization. Mandate extended external entities to provide data. Understand erasure, legal versus justice system, apply a systems theory, ownership of being responsive to inquiries, define human trafficking as it applies to Navajo, what needs to be collected, and build our analytic capacity. Encourage public health groups to be involved, lay out our assumptions, perceptions, gender, educating Navajo elders on LGBTQI, Nadle, traditionally a holy being who could change to confuse the monsters. Influence of Western culture affects Navajo fundamental understanding. Historically, Nagle helped families in several capacities. And then the grieving process of families, how do we support them? Something on the Navajo Nation to focus on resources currently available, data statistics, cultural competence, language, culture, values, providing opportunities to learn how to live in Hajo, and then creating healing spaces to guide and understand. There's a lot of stuff. There's a lot of things. That was our very first conversation. I mean, it's a lot. And a lot of the stuff that you heard yesterday and this morning kind of touches on that, doesn't it? I mean, there's some stuff that we didn't talk about this forum, but it's the things that you hear repeated are possibly things that are very important. And there are things that we should carry forward. So on the walls, you see these flip chart sheets. Those are actually our action teams. So we have been working on some of the actions that we created. And so as I'm telling you these things that we've already talked about, if there are things that stand out to you, and when we go into the smaller groups this afternoon, if they are not reflected on the action sheets, you're more than welcome. And if you think it's important and if you're willing to work on it, yesterday, Delegate Crotty said, if you feel like we should be doing something, then you need to really see your place in helping us achieve that. So if you are willing to work with us and be part of our team, you're welcome to put it on those action sheets. So we talked about strengths after that. We talked about quite a bit of strengths. We talked about some of the weaknesses that we have as a group. We talked about opportunities, and we talked about threats. And finally, after all of this discussion, we came up with a framework, what we thought our vision, our shared vision looked like. So we said identify and prioritize key strategies that would take us forward into action planning. What components, ideas must the framework include? And so the group came up with this. They said that we would have these two components feeding into this, and this would feed into that, and then all of this would underlie and support these things. So that's how they explained it. There's actually, apparently this is like a theory, but I don't remember which theory it is. So we have collaboration, communication, spiritual, cultural, infrastructure, traditionally tailored foundation, implementation, indigenous data sovereignty framework. That's on that big square with the arrow. This guy here. Wait, nope, doesn't get it. Okay. And then we have leadership comprised of grandmothers and matriarchs, and those two feed into a comprehensive comprehensive risk analysis, a research analysis, and then that also feeds into breaking the cycle, interruption of missing murdered relatives, and prevention. You also get positive outcomes through holistic healing, and it endures administrative changes. That was one of the things they wanted, sustainability. And then we can use that to get funding. But all of this underlies and supports the communication and collaboration. So it all goes back. So again, you see the circle again. So that's kind of where we started. And that was our shared vision. Our second forum was the action planning, and that was at NAU in Flagstaff, August 15 and 16, 2019. Our agenda, Council Delegate Amber Crotty welcomed us. We had a presentation on Arizona HB 2570, the study on missing and murdered Indigenous women. Valora Imus, I'm going to butcher the last name. Nasan Hoya, I think that's how it is. Hanwang Z Consultation Services